Thanks. Getting access to health care can make needed procedures seem out of reach for some. But what if you know your insurance should be covering those costs? The Let Joe Know team finding after a recent story, a billing problem at a Valley Imaging Center, which seems to be even more widespread. Joe Ducey live tonight. And Joe, this is a popular place for both MRIs and x-rays.
Yeah, Zach, we're talking about Simon Med Imaging. This one's in Mesa. They've got them all over the place, about 50 in the Valley right now. We're hearing from many people who are sharing one woman's story who says she was a patient forced to pay upfront costs which she shouldn't have to pay. We told you about Samantha and her issues with Simon Med Imaging.
They know they have a broken system, but they're not doing anything about it. Everybody is paying them because they are bullies.
As an amputee, she's needed several x-rays and scans done at Simon Med, and each time she was told she had to pay hundreds of dollars despite her insurance covering the bill. Soon after that story, many others shared theirs. Jennifer writes they told her to pay up front 5 minutes before her MRI appointment, saying her insurances wouldn't cover $1,200. She paid and is now waiting for her refund. Her out-of-pocket cost was only $33. Stephanie shares she made 15 phone calls ahead of her Simon Med visit. They told her she had to pay $800 when she says her cost was nothing.
She said, well, if your insurance will pay for it, you'll get the money back.
Elle says she felt cornered, worried about scan results.
I was a little apprehensive about it going in anyway. So I write the check.
She says it took almost 8 months to get her money back.
It wasn't going to prevent me from buying groceries or paying my, it wasn't that situation. But, there's an awful lot of people that are in that situation.
A lot of money. There could be a lot of money to pay up front when you don't have to. We tried contacting Simon Med about this repeatedly, asking about the dispute process, about the billing process. They finally did get back to us with a statement. Simon Med says because of privacy reasons, they can't talk to us specifically, but they say they have taken many steps and continue to focus on patient billing practices and scheduling, as well as ensure adequate staffing. So basically, in other words, they didn't answer our questions.
Yeah, they didn't, Joe. Well, the question a lot of people have now, is there anything they can do to avoid these upfront costs?
I think what people have to do is know before they make an appointment what their insurance costs are going to be, then contact the facility. If they're not willing to go with that, ask the provider for a different facility. There are others. This isn't the only one in town. Back to you.
Good advice there. Thank you, Joe. And you can find more on this story at abc15.com/letjoeknow.